Hello everyone, myself Divya, Assistant Professor of Sharda School of Pharmacy, Peethapur, Gandhinagar, Department of the Pharmacology. Today I am going to discuss about the topic that is diabetes mellitus. These are my contents which we will discuss in this topic. Now, what is diabetes mellitus? So, diabetes mellitus is a group of metabolic disorder sharing the common feature of the hyperglycemia. So, what do you mean by hyperglycemia? Hyper means increase and glycemia means glucose. So, suppose a person will have a more glucose level in blood, that is a disease known as the hyperglycemia. So, diabetes mellitus is diagnosed when blood glucose level become too high. So what is a normal blood glucose level? Suppose I am not eating for last 8 hours. I am on my fasting stage. So suppose I check my diabetes level, so it is between 80 to 100 gram per deciliter, right? And after the post meal, after 2 hours, suppose I check my diabetic level, so it is less than 140 gram per deciliter. So I am not a diabetic. Now, who regulate the blood glucose level? There is an two hormone, insulin and glucagon. There is a homeostasis in the glucose level between the blood and the cell, which is maintained by the two hormone, insulin and glucagon, right? We already know that insulin is secreted by beta cell of pancreas and glucagon is secreted by alpha cell of pancreas. Insulin is a hormone, right, which is transfer glucose from blood into the cell, and glucose is stored in the form of a glycogen, right? And basically insulin is a decrease the glucose level and it is shifting the glucose from blood to cell, while in the case of the glucagon it is doing just reverse. It is splitting the glycogen and moving it into the blood. So glycogen is increased blood glucose level. So we human have a capacity to decrease the blood glucose and to increase the blood glucose level according to need. So what are the problem in the diabetes? Body has trouble in moving the glucose from blood to the cells, right? So problem is the insulin. Either insulin is absent or insulin is present but it is not functioning. So obviously blood में जो glucose की concentration है वो increase होगा and it is caused as an hyperglycemia, right? And other hand decrease the glucose in the cells. So the chronic hyperglycemia may also cause the damage in the various vital organs, right? And other hand the cell gets a starve for energy. Classification of diabetes mellitus. Basically there are two type of diabetes, type 1 and type 2, and third type is a genetic defect of the beta cell functions. These are known as a MODY. So what is the full form of MODY? That is a maturity onset diabetes of the young. So there are 6 type of MODY: MODY 1, MODY 2, MODY 3, MODY 4, MODY 5 and MODY 6. Next is a genetic defect in the insulin actions, then exocrine pancreatic defect. It can lead to diabetes mellitus. Endocrinopathies. There are some infectious agent which can damage our beta cells of pancreas. Then many drugs in front of you which cause the hyperglycemia in the person. Apart from it, there are some syndrome, genetic syndrome which are associated with the diabetes. Then last one is a gestational diabetes mellitus for the pregnancy. Here I am teaching you type 1 and type 2 diabetes mellitus. In type 1 diabetes mellitus, it is a rare, only 10% cases are there. In this it is also termed as a juvenile onset diabetes. Why it is known as a juvenile? Because it is occur at a younger age, right? Then second one is insulin dependent diabetes mellitus. Why it is insulin dependent? Because only treatment is a insulin, right? No other oral hypoglycemic agent, right? So insulin is an injectable form, not in the tablet form, and person have to take subcutaneous injections before every meal. Whenever they eat, they have to take injections, right? So, in type 2 diabetes mellitus, about 90% of case is a type 2 diabetes mellitus. It is also termed as a maturity onset diabetes because it is occur at older age. Then second one is a non-insulin dependent diabetes mellitus. पैथोजेनेसिस ऑफ टाइप 1 डायबिटीज़ मेलाइटिस। टाइप 1 डायबिटीज़ को हम ऑटो इम्यून डिजीज़ भी बोल सकते हैं बिकॉज डिस्ट्रक्शंस ऑफ बीटा सेल्स by immune effector cells known as the cytotoxic T cells. Sometimes these cytotoxic T cells become the abnormal and it is react body's own cells. So that's why it is known as a self-reactive cytotoxic T cells. ये जो T cell है, cytotoxic T cell है, वो हमारे बीटा सेल को डिस्ट्रक्ट करेंगे. सो दैट्स वाई बीटा सेल्स कैन नॉट मेक इनफ अमाउंट ऑफ इंसुलिन. So insulin is decreased. So it is known as a type 1 diabetes is known as an autoimmune disease. So there is a process to eliminate these cytotoxic T cells. ये जो cytotoxic T cell जो है वो हमारी बॉडी में बीटा सेल को डिस्ट्रॉय कर रही है. जो बीटा सेल्स इंसुलिन सिक्रेट करवा रहा है. सो बीटा सेल्स अगर डिस्ट्रॉय हो रहा है तो इंसुलिन डिक्रीज हो जाएगा, राइट. सो हमारी बॉडी क्या करती है, सेल्फ टॉलरेंस मैकेनिज्म एक्टिवेट कर देती है. सेल्फ टॉलरेंस यानी क्या, इट इज़ अ एबिलिटी ऑफ बॉडी टू डिस्ट्रॉय दिस मैड टाइप ऑफ लिम्फोसाइड. मतलब ये जो साइटोटॉक्सिक टी सेल जो है इसे हम मैड टी लिम्फोसाइड में बोल सकते हैं. तो ये जो मैकेनिज़्म के ज़रिए ये साइटोटॉक्सिक टी सेल जो है वो एलिमिनेट हो जाएगी. In type 1 diabetes mellitus, there is a genetic abnormality and environmental trigger. Now, what is genetic abnormality? So, all cell have a nucleus, right? And inside the nucleus, we have a chromosome, either a 46 chromosome or a 23 pair of the chromosome. In pair number 6 of chromosome we have a gene. Name of this gene is HLA. We know all gene form the protein, so this gene also form a protein, right? For the help of the transcription and translation, this HLA gene is also form the protein. Name of this protein is MHC protein, major histocompatibility complex. This MHC protein going inside the T lymphocyte surface. मतलब ये जो MHC प्रोटीन है ये MHC प्रोटीन T lymphocyte के सरफेस पे जाके बाइंड हो जाएगा. This MHC protein is important for the recognize like who is a self cells or who is a foreign. मतलब ये जो MHC प्रोटीन है वो इम्पोर्टेंट है रिकॉग्नाइजेशन करने में कि कौन सा सेल्फ सेल्स है और कौन सा फॉरेन सेल्स है, राइट. सो दिस टी लिम्फोसाइट ओनली किल द फॉरेन, right? If suppose HLA is a mutated, suppose HLA जीन में कोई suppose म्यूटेशन हो गया, so HLA is a form MHC जो एबनॉर्मल होगा, राइट. सो एबनॉर्मल MHC है वो कैन नॉट रिकोगनाइज हु इज़ अ फॉरेन एंड हु इज़ अ सेल्फ सेल्स. सो MHC रिकोगनाइज सेल्फ सेल एज वेल एज एंड फॉरेन सेल्स एज वेल एज, राइट. मतलब वो अपने को भी फॉरेन मानेगा, राइट. सो दैट्स वाई दिस टी लिम्फोसाइट become mad or become abnormal or become cytotoxic because of this MHC protein, right. And second one is environmental trigger. So suppose a virus are there, virus have an antigen, right. So antigen, name of this antigen is epitopes. The same antigen is present in the beta cells. Epitopes is present as well beta cells as well as virus antigen, right. So body is forming antibody against them, right? So antibody will bind with both antigen and as well as beta cells of the pancreas. So these two, genetic abnormality and environmental triggers, due to this loss of self tolerance. Due to loss of self tolerance, there is a no or not kill of T lymphocyte. So this T lymphocyte will attack our beta cells of pancreas. So beta cells अगर डिस्ट्रॉय हो जाएगा तो उसमें से इंसुलिन इनफ अमाउंट में सीक्रेट नहीं होगा. सो देर इज एन डिक्रीज इन इंसुलिन एंड इंक्रीज इन ग्लूकोज इन ब्लड लीड टू द hyperglycemia. Pathogenesis of type 2 diabetes mellitus. Type 2 diabetes is a complex disease that involves the genetics and environmental factors as well, and constitutional factors such as obesity, the hypertension, and the level of physical activity play a contributory role in the insulin's resistance on the target's organs, can lead to the hyperglycemia. So as I already discussed, in type 1 diabetes, the beta cells of pancreas is damaged due to some genetic effects or some environmental defects. The whatever the effect, beta cells are destroyed by body's own immune cells. But in type 2 diabetes mellitus, the problem is not the pancreas of the beta cells. The beta cells is absolutely normal. So body can synthesize the insulin, and insulin is present in the blood. So the problem is that insulin which is present in the blood cannot act on its receptor on target organ. So name of this target organ is a tetrameric receptor, which are present in the target organs like the livers, smooth muscles, and adipose tissue. So these tetrameric receptors are defective, so insulin can not bind to this receptor, is known as the insulin resistance. So since insulins cannot bind with the tetrameric receptor, the door for entry of the glucose, that is suppose GLUT4, right? So it cannot open, GLUT4 cannot open, so glucose cannot enter, and glucose is remain in blood only, and it is called the hyperglycemia, and lead to the type 2 diabetes mellitus. Now, environmental factors for type 2 diabetes mellitus. The most important environmental risk factor for type 2 diabetes is obesity. So, the greater than 80% of individuals or people with type 2 diabetes are obese, and suppose a lack of exercise another risk factors for diabetes mellitus. Now, how obesity leads to the type 2 diabetes mellitus. So the central adipose tissue is a more lipolytic than the peripheral. So the central adipose tissue convert into the free fatty acids, and the obese persons have excess of the free fatty acids in their blood. So this free fatty acid will convert into the diacyl glycerols, so which go into the target's organ, that is a liver, the smooth muscles, and the adipose tissues. So the receptors of insulin is the presence on this target's organs. So after the insulin there is an IRS change. So insulin receptor and IRS chains will destroy by this DAG, that is a diacyl glycerol. So this is how obesity leads to type 2 diabetes. In this diagram, insulin receptors have a 2 alpha and a 2 beta chains, and after insulin receptor there is an IRS chains. So DAG will destroy insulin receptor and IRS chain as well. So insulin cannot bind with this insulin receptors. So GLUT4 not open for glucose, entry of glucose. So the glucose cannot enter and lead to the insulin receptor insulin resistance. So accumulation of the glucose in blood, and which leads to the hyperglycemia. Now, what will be the clinical features or symptoms that is present in diabetic patients? So, it is at an early age, below the age of the 35. The clinical features are the polyuria means increase the urine, polydipsia means increase the thirst, and polyphagia means increase the hunger. Now, why polyuria means why increase the urine in type 1 diabetes mellitus? So, suppose there is a condition of hyperglycemia means more and more glucose in your blood, so glucose is going into the kidney for the excretions. Now suppose glucose is a one type of sugar, so sugar is an osmotic in nature, so it will also drain the water, and जो ग्लूकोज है वो ग्लूकोज अपने साथ पानी को भी ले जाएगा, राइट. सो दिस इज द रीज़न फॉर polyuria, and the patients have again and again urination because of this excessive water. So now, due to this polyuria, all the water is excreted out in urine, so blood is becoming the more concentrated, right. So this concentrated blood is also going into the brain. So we know that the brain have a thirst center, right. So thirst center is stimulated and activated, so person feel thirsty and drink the more water, so that is the reason. Now polyphagia means increase the hunger. So either suppose either decrease or absence of insulin, or insulin is present but it is not functioning in type 1 and type 2 respectively, so glucose can not enter into the target cells, so these target organs can not get energy, so they will form ATP from proteins and lipids, right. Generally they have form ATP from the glucose, but here glucose is absent, so प्रोटीन एंड लिपिड से वो एटीपी फॉर्म करेंगे, राइट. सो बिकॉज ऑफ प्रोटीन एंड लिपिड्स ब्रेक डाउन और डिग्रेडिंग बाय टारगेट सेल्स और ऑर्गन, सो बॉडी विल लूज द वेट, right. And because the degradation of the proteins and lipid increase hunger also, right, in diabetic type 1 patients, so this is the thing. And apart from it, weight loss is there, and fatigue, nausea and vomitings is there, and they always have two complications like the ketoacidosis means increase the excess acid productions in blood, then hypoglycemic. Why hypoglycemic? Because suppose अगर आपने ज़्यादा इंसुलिन इंटेक कर लिया, it can cause your blood sugar level too low, and it is directly lead to hypoglycemia, right. Let's talk about clinical features of type 2 diabetes mellitus. Usually above the age of 40, and the onset is very slow, and they don't have any symptoms. It is generally asymptomatic. At a later stage, the type 2 diabetes patients have a polyuria and polydipsia also. They are frequently obese person, and ketoacidosis sometimes complications is seen, so it is a very less complications in type 2 diabetes. Now, complications of diabetes, there are two complications: acute metabolic complications and late systemic complications. In acute metabolic complications, first is diabetic ketoacidosis, that is usually happen in type 1 diabetes mellitus, and second one is hyperosmolar hyperglycemic non-ketotic coma, as that is happen in type 2 diabetes mellitus. So in late complications, it is occur at many years. So first is atherosclerosis. So in blood vessels cause the atherosclerosis. So if atherosclerosis is taking place in coronary artery, so it will lead to myocardial infections. And suppose atherosclerosis taking place in the cerebral artery, it will lead to stroke. And atherosclerosis occur at a lower extremity, cause the ischemia. Then in it involve the organs, vital organs like the kidney, nerves, and the retina of the eye. So diabetic nephropathy, so it involve kidney involvement, the diabetic neuropathy, the nerve involvement, and the diabetic retinopathy, the retina of the eye is involved. Apart from it, diabetic persons have a more chronic infections because blood glucose level are too high, and the organisms loves the sugars. So these are the complications of diabetes. Thank you for watching and listening me. Please like, shares, and subscribe our YouTube channel Sharda Campus. Thank you so much.